So anyway, so this patient presented, and she was short of breath. So we admitted to the hospital and started on intravenous diuretics. She had episodes of worsening cardiac arrhythmias. Now, when she got in the hospital, she would have these episodes of heart. She'd go into AFib or atrial tachycardia. Remember, I talked to you earlier. Underlying cause of some of these arrhythmias, oxidative stress, inflammation. At the cellular level, increased calcium inside the cells, increased arrhythmia. So the electrical part, number one, that we talked about on oxidative stress, could have been contributing here. So we see the arrhythmias. Yeah, we give her medications, but we must also think about the underlying process. So we had to put her in the CCU for closer observation. We gave her medications. We've got her arrhythmia stabilized, got some of her cardiac function improved. So after, it took about 2 or 3 days, maybe 4 days to get that done. I call the structural heart team. The reason for admitting her was to consider her for a procedure called mitral valve clipping. They can go in with a catheter and clip the mitral valve to keep it from, to allow it to close more efficiently and keep the leaking from progressing. The structural heart team, which is a group of cardiologists, colleagues of mine, excellent guys, they felt that she was too sick for the procedure. It wasn't an open heart, but it was, so they looked at her and they read the chart and they saw us struggling with the arrhythmias, saw that she has a history of lupus and looked at the ejection fraction. But look, with her comorbidities, we felt she was too sick. I talked to my EP colleague and felt that, well, could she benefit from a biventricular pacing? I mentioned she had that electrical abnormality. If we were to fix that with pacing, synchronized pacing, that could also help the cardiac function. She looked at it and felt that she was too sick also. And she probably saw the note from the structural heart doctors. So she was too sick to undergo those procedures. And that was the main thing we were going to look at to improve her condition. So, they recommend calling the palliative team, and our team called the palliative medicine team. And they said, well, let's get her in inpatient hospice. And so we optimized the medication, got her stable. We had her on, she was taking an over-the-counter vitamin C that she had. We left on that. She was on the diuretic. She was taking hydroxychloroquine for her lupus. And we put on an infusion medicine called milrinone. It helps strengthen the heart a little bit, helps it squeeze a little bit better. She was on pantoprazole, which they typically start. And the sotalol was the medication we had given her to control her arrhythmias. Now remember, oxidative stress, inflammation, triggering the arrhythmia mechanistically, but we were treating it pharmacologically with this antiarrhythmic drug. So the patient, agreed to go to hospice, and, we're just going to go there and kind of wean her off and let her pass on. Nobody had much to offer. So when we discharged her to hospice, she came back in about 24, 36 hours because there was some confusion. The hospice unit was not able to manage the IV milrinone. And so they called around to other hospice facilities, and none of them gave milrinone. So the palliative team was called back, and they said, well, it's nothing we can do. We just have to stop the milrinone here in the hospital and let you die here. So I went in the patient room, and, she was in tears and says, I'm about to order my last meal, and, everything's bad. And I said, look, none of that. I've got an idea. More tricks up our sleeve. So we said, let's just detox the patient. Again, thinking about those underlying mechanisms. Why is she so sick? Well, she's in acute inflammation, oxidative stress. So she's got, end-stage heart failure. There's nothing to do. Too sick for surgery, too sick for medications, too sick for everything else. But she wasn't too sick for detox. I talked to the hospital case manager. Look, give me 7 days. And we will detox her and wean her off the milrinone. Now I had to convince the patient this is going to work. So I said, look, enough of this pity party. We need to detox. And I said, here's what we're going to do. We're going to do this, and this is how it's going to work. Now that's an important factor because the patient has to be on board mentally, psychologically, and everything else. So she was with it. Okay, let's do it. So we brought her, raw smoothies, and green salad. I saw it on the smoothie feast with lots of blue-green algae, super greens, all of that. So she was just on smoothies. The important part is just on smoothies, raw smoothies up front, is that, someone this sick, digestion is going to be a problem. So we don't want to give her solid foods. So smoothies or cold pressed juices can be very, very helpful. What it does, it nourishes the body, allow you to rest biochemically. And as she was doing that, it was helping to put out the inflammation and oxidative stress and we remove every bit of the other food.
Dr. Montgomery, can you specify what types of smoothies? I know you said green, but when you say green, are you talking about fruity green? Or are you talking about
Yeah.
just straight
So
vegetable green?
yeah, good question. It was mostly vegetable greens. Now we would add like one fruit. Sometimes we do soaked organic dates to cut the bitterness, just to give the patient a sense of pleasure. But the smoothie she had contained beets, kale, spinach. We had blue green algae, which is a superfood, and we also had our super green mix, which is a mixture of organic greens. I think it has wheatgrass and it also has an algae in it, but it's freeze dried, it's organic, broccoli, spinach, it had other sprouts in it, lots of superfoods in it in a powderized form that we mix in with the smoothie and added it. There was some fruit. It's usually like in ours, we usually do like a date. Sometimes it'll be a mango, something a little sweet to cut the bitterness of some of that. So that's what we did with her. The other important thing we did was wean her medication. I cannot overemphasize the importance of weaning medications. If any of you have loved ones, you're trying to help them nutritionally, get with your doctors and ask the doctors to help minimize the medication as much as possible, because that's important. And that's the thing we did with her. So in summary, I'm just going to kind of go through some of the clinical details. Excuse the business of the slide, but serum creatinine is a molecule that we measure to look at the kidney's filtering ability. So the higher this number, the worse the filtration. The lower the number, the better the filtration. When she came in, her filtration rate was low, so this number was relatively high. It improved with some of the medications. When she went into the arrhythmias, it got a little bit worse because her circulation of the heart was worse, and so the kidney function was worse. We got all that arrhythmia under control and the melanone, and this is when she was discharged, but they couldn't give the melanone. She was off the melanone. The kidney function got worse because the heart function got worse in just that 24 hours. So it got worse. So we started to detox. This orange bar represents the time of detox. And we detoxed it, she came down. Now remember, we were detoxing and weaning medication. So she was coming off the melanone and off the other medication. But despite coming off the medication, she remained stable. So the kidney function remained stable. The GFR is kind of the opposite of the creatinine. So the higher number, the better the kidney function. The lower number, the worse the kidney function. So she came in, the kidney function was okay, got worse with some of the arrhythmias, got better with stabilization. Got worse with the arrhythmias here, better with stabilization of medications. Went out, but when she got off the melanone, it got worse here. And so here you have, we start to detox and the kidney function improved. The GFR's perfusion, off medications, on nutritional detox. Lactic acid. When lactic acid is high, that means your circulation is low. You're not perfusing, so the tissues create acid. When she came, we got it down when we stabilized her, but when she came back and went back up, she was off the melanone. Detox brought it back down. Again, liver congestion, it stayed down with detox. Same thing, liver congestion stayed down with detox. White blood count's a measure of inflammation. It went up and down. After you started detox, notice how it went up. And that's the sign you see with detox. Sometimes after you started detox, you have an acute inflammation. It's probably due to the fact your body's releasing toxins from the cells into the blood, but it came down as well. But the big thing is that we weaned her medication. Now, I stopped this vitamin C because of over-the-counter vitamin C. She was on regularly scheduled furosemide, which is a diuretic, regularly scheduled hydroxychloroquine, which was supposed to decrease inflammation from the lupus. The melanone was her lifeline. That's what we were going to stop and let her die. So we had on melanone, pantoprazole in this arrhythmia. We control all of these things. We control the arrhythmia. We control the cardiac function. We improve the heart function. And we decrease inflammation from the lupus. And we allowed the heart to perfuse the kidney so that she didn't need diuretics. We had on one diuretic on an only as needed basis. And I'll tell you, she really didn't need this. She took it maybe once or twice. But after she was out for the 3 months that she was out, so 2 or 3 months immediately after discharge, she probably only took maybe a few doses at most. So essentially almost no medications. And that was important because the medications are frequently metabolized by the kidney and the liver. So medication change, a major, major drop there. Again, reflecting on the mechanism, the food was treating the arrhythmia and the heart dysfunction at the cellular level. Remember, we talked about inflammation, oxidative stress causing what? Increased calcium in the cells, electrical problems, atrial fibrillation, atrial arrhythmias, causing what? A contractile dysfunction, weakening and stiffening of the heart. All those things mechanistically was happening at the cellular level, the tissue level. When we address those things with the food, again, at the cellular level, the tissue level, we were able to remove the medications, and the heart started beating more effectively, relaxing more effectively, and controlling the arrhythmia by mechanistically treating the body, treating these mechanisms. Oxidative stress was reduced, inflammation was reduced, and the cells started to heal at the cellular level.
Can I ask a question real quick?
Yes, absolutely. Yeah, please interject.
In the applications standpoint, with just the liquid detox part, how long was that? How long did it take her to get to a level where you said, okay, we can do solid food, raw food, in addition to the liquids? Because I just want to know how long, I know the dates were on some of that, but from the start to kind of we're seeing improvement, how long did that take with the liquid versus liquid plus raw foods?
Yeah, that's a great question. Every patient differs. And in this patient, I remember on day 4, we started adding salads. She stayed on the smoothies. We started adding salads. And the barometer there was that she was on day, like 4 days. She had, I think, maybe 4 full days of just smoothies. And then she started saying, okay, I want some salad. So she started feeling hungry. She was feeling better. And those first few days, she was getting better. And then her appetite picked up. And so what happened, then we started adding salads. And then I think she even had some of our raw. I may have even had her try like a beet burger or something like that, which is actually a pretty heavy food. Now, she was still on the smoothies with the coconut water and that type of thing. But then we added some salads probably on day 5 or 6, and as she was going out of the hospital. And that was just for patient comfort and satisfaction and the like.
Okay.
But yeah, but just an added comment, what I try to do in a patient like her, I would try to do like 10 days of all smoothies or cold pressed juice, or maybe even 2 weeks. So I like to have them go even longer with time restricted eating, because the longer we go with the more aggressive detox, the more healing. And I'd even add a time restricted eating. So, we probably go, full day smoothies and juices at the beginning, and then do some time restricted eating, maintaining hydration, because then that gives more healing. And again, we're letting the body recover over time. So yeah, that's a great question. Now, just looking at some of the data we've done before. So why do we know to do this? Well, we've actually published in the medical literature patients undergoing a very, very similar, or to some extent, the same type of raw detox. And we look at the biochemical parameters. Everybody knows about hemodynamic and anthropometric effects, i.e., weight loss and blood pressure reduction. Now, these things aren't trivial because, yes, we measure these things. Weight loss is important for patients who need to lose weight. Blood pressure reduction is important. But this patient actually had a tenuous blood pressure, and she was already on the small side. So she didn't lose a lot of weight. And sometimes the blood pressure low, it comes up. So this was a population of people with hypertension and high BMI. And so they had weight loss and blood pressure reduction. But some people with weak hearts can have the blood pressure improve with cardiac output improving and cardiac function improving. And so, but they also had medication reduction. Why do I hound on medication reduction so much? Medication reduction is important because in these patients that are taking medications that have to be metabolized through the liver, et cetera, notice this patient has some liver congestion. If you're taking a medication that has to be broken down by the liver, and the liver is already under stress due to heart failure, then you're putting the liver under further stress by giving them medications. And sometimes the liver is under stress due to poor circulation. They may have fatty liver from taking medication for a long period of time. So the more you can wean the medications, the more you take a stress off the liver. Why is taking stress off the liver important? The liver is the main organ for doing manufacturing, and also has a function cleaning the blood. So the less toxin you're putting in, the less toxin the liver has to neutralize, and the more it can work on endogenous toxins to help clean the blood up. The cleaner the blood, the better the heart function, better the kidney function. So these things have a synergistic effect. So medication reduction is extremely important in that regard. In our study, we looked at a case series of heart failure patients. We saw that the ejection fraction in a case series of patient went up on an average of 22% to 44%. The thickening and stiffening of the heart mass went down. Remember, I told you some oxidative stress can cause thickening of the heart muscle cells. We saw that reverse with nutrition alone in our case series. When we look at MRI, measuring the thickening of the heart, we saw stroke volume, the amount of blood that the heart squeezes. Remember, the amount of volume of blood the heart squeezes out is a factor of the amount of blood that comes in. How much blood comes in is the amount of the relaxation of the heart or the lack of stiffening. So the stiffer the heart, as we talked about, increased calcium influx, decreased nitric oxide, results in thickening and stiffening of the heart muscle. If you have that thickening and stiffening, the stroke volume is low because you don't fill up as much volume. So LV mass is a measure of thickening. Stroke volume is a measure of stiffening indirectly. And so we saw an increased stroke volume, likely due to decreased stiffening, and overall circulation, cardiac output trended toward improvement. Here's some other biomarkers. C-reactive protein is a measure of inflammation. In just 4 weeks, we see a 30% reduction in inflammation. So we know with a raw detox diet, we have an aggressive reduction in inflammation. IL-6 is an important cytokine that triggers other cytokines, a 23% reduction in IL-6. TNF-alpha, we didn't see a reduction in 4 weeks. It may take longer for this to go down. Plaque-2 is an indirect marker of vascular inflammation. It goes down by 16%. White blood count goes down by 22%, and other inflammatory markers go down. So we know that inflammation goes down. The immune system is turned down, so it's no longer in disarray. Cholesterol, other biomarkers go down. Hemoglobin A1C is a metabolic biomarker, and we see that go down by 3.4% in just 4 weeks. Now you say, well, those you know what the hemoglobin A1C is, it marks the average blood glucose in 3 to 4 months. But what happens is that the other thing that influences hemoglobin A1C is what we call postprandial increases in blood sugar. So certain foods you eat, like foods with high protein, high fat, trans fats from dead animal flesh, it causes the blood sugar to go up after you eat. And so that causes a fluctuation in blood sugar. So this fluctuation in blood sugar with these wide swings can increase hemoglobin A1C. When you go on a raw detox, it decreases the fluctuation of blood sugars and decreases the hemoglobin A1C. C-reactive protein we already talked about. So as Dr. Palmer asked about the food, there's a quick word. Generally speaking, we allow them to eat some solid foods. This patient had mostly smoothies. She had some solid foods later on. She had something equivalent to this. These are nori rolls. You can think of this like a salad and a roll. This is our beet burger, a Hulk burger. These are dehydrated onion rings. These are sprouted wild rice. So you can have a lot of savory raw foods. And there are other patients are treated in the hospital, and they get the food from a nutrition center. We try to keep them off the hospital food. Better than tuna sandwich, which is delicious. The E3 AFA, this is a powder form of the E3 Live. We have them do a liquid form or powder form. We add it to coconut water. And this is a superfood that has lots of minerals and vitamins and nutrients. Our premium green greens we have that helps with detoxifying the body. Again, this has freeze-dried organic grown vegetables. So the food is quite palatable, and it's something that can really help. I throw this slide up here just so that you guys can have some information about us. Take a screenshot if you want to learn more about some of our programs. We have an online community that helps talk about this stuff, the website, and we do online coaching. So if you have a condition and you're from outside the Houston area, we can still reach you, and this is based on information. So I'm going to leave it there. Thank you for your time and attention. Dr. Palmer, you had another question or comment?
Well, I was going to just ask you to answer some of the questions in the chat. Now, you hit most of them.
Oh, good. Yeah. Thanks for keeping up. I've been kind of glancing, but I haven't.
Yeah, you touched on most of them. One question that somebody had that, is a fair question. Once the heart weakens due to oxidative stress, can the weakened heart regenerate itself once the patient detoxes and changes their diet long term? or once the heart is weakened, it's always weakened. So, I mean, I think we kind of already answered that, but then the next part of that I think patients don't recognize, the idea is that you stay in that lane. Like, the idea is not that you heal and get better and then go back to your previous life.
Yeah, no, that's a great point you raise, and the answer is yes. It can heal. It may not go totally back to normal, but as the case series I showed you show that you get improvement, significant improvement. And notice that it's improving not only with the heart but the whole cardiovascular system. Notice that not only the heart's improving, the liver's improving, the kidneys improving, and the GI tract's improving, the microbiome. So all these organ systems are working in synchrony, in symphony, and they're working together. And so they're enhancing. So the heart may not be back to normal, but it may have some deficiencies made up by another organ system, et cetera. And so the whole body will get back to a state where it's functioning normally when you're doing better. And even the brain, so the psyche, which is really important. So this patient went from hospice to say, okay, you're on no medicine, you're feeling fine, you walk around the hospital and going home and you're doing great. So that's a huge psychological boost. So even that part is contributing greatly. But I think, Dr. Palmer, you touched on an extremely important point, which is staying in the lane. Now, I cannot overemphasize this because her disease, despite all the stuff I showed you, was not heart failure, was not mitral regurgitation, it's not lupus, it was not, blah, 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 liver dysfunction. Her disease was the desire for bad food. And we all develop a lifelong desire for the foods that are detrimental. And it's really the desire for those bad foods that's the treatment, because we could do all this stuff, you could detox and get better, but if you have that continued desire for the bad food and you give in to that desire, you fall back into that and it can lead to your demise.
Somebody else asked, will raw program help with chronic liver scarring or hepatitis?
Yeah, we see that a lot, and the answer is yes. It's really interesting because people ask, how late is too late? I think the only time we've tried this in the group of patients, we got consistent failures when we went to the graveyard and we sprinkled detox food on the graves, and we've yet to have anybody rise. So that's something that we're still working on. But short of the grave, we've seen people on life support turn around. So regarding the question of liver disease and hepatitis and scarring, yes, you have scarring, but typically people with scarring has some viable liver tissue, and some of the tissue that looks like it's scarred may not be fully scarred. So again, you need to do aggressive detox and cleansing, and medication weaning, I cannot overemphasize that, is extremely important in those patients.
Somebody asked, how much vitamin C?
Yeah, great question. So the vitamin C in patients with vascular disease, we will start them off with, say, about 3,000 international units, and we'll go to 9,000. It just depends. So like people with bad atherosclerotic disease will probably use more. People with cancer will probably use more. And some patients in the hospital, I'll use intravenous vitamin C a lot. 1,500 milligrams every 6 hours, or that's roughly 6,000 milligrams a day intravenously. It's been shown to reduce oxidative stress and reduce inflammation, etc. So, question.
One more looks like I'll recommend to be a pacemaker. Can you help?
Yeah, that's a great question. We've had different situations with pacemaker issues, and with heart failure, we were talking about doing biventricular pacing in this patient, and my colleague says, she's too sick. And so we got her well without it. So the answer to that question is yes. In certain cases, it can. Some people have advanced conduction system diseases, threatening to pass out. In those cases, you may want to do pacing initially to protect them, and then start to reverse things over time as it goes. Let's see. Did we catch everything? I think we
could. Somebody asked about, do you do online coaching, which you can do your commercial?
Yeah, the day if you got that information, online coaching, you can go to. Let me just bring that slide back up, just to be um, there. So the online coaching, I'll leave that up for a minute so you can look at it. But online coaching is there.
She asked, do we have to be seen in person for the first visit in order to access the online coaching?
No, you don't. That's a great question. So for online, all of these things here, the community, of course, our website has lots of information. The online coaching is a non-clinical online position. So you can go on that today, online.montgomeryheart.com/lifestyle. And that's our healthy lifestyle series. That's the one that we recommend. That's a 1-year coaching. You start off with a detox session series where there's 5 sessions over 4 weeks. And we walk you through a detox program. And then you have lots of content. You have videos, like 30-day videos of me walking through detox and maintenance. You got recipes, got video demos and the whole like. And there's educational videos with that. But you have access to myself and my team where we can walk you through the specifics. So that's a great program to go through, online.montgomeryheart.com/lifestyle. Take a screenshot here. But yeah, that's a great, and none of these require a office visit. Of course, you want an office visit, you're welcome to call us on the number 713-599-1144 and wellness@montgomeryheart.com as well. And we're located in Houston at that address. But great question. And hello, everybody. I'm seeing some familiar names. Sorry, I was just focused on my slides. How can you help someone with a mitral valve leak and surgery is not required now? I think the same thing we did here. And remember the leaking valves. Think of leaking valves or stiff valves that are inflamed. So if you have a valve that's inflamed, it will not close normally or may not open normally or both. And so there's some acute components and chronic components, but aggressive nutritional cleansing can reduce the inflammation and help the valve heal and or prevent the valve from getting worse. So if someone has a leaky valve, doesn't require surgery now, they want to make aggressive change in their lifestyle. So then that valve certainly doesn't get worse and may even improve or leak less because the less leaking may be due to other components other than just valve disorder itself. So that's important. How to increase your ejection fraction. Again, the things that contributes to your abnormal ejection fraction are the ischemia and oxidative stress. That's why I went through all that biochemistry at the beginning. And so you affect those things directly with the food. That's what helps biochemically. And so that's going to be the critical factor. If you're seeking to be weaned off medication, will online coaching be helpful? We don't directly wean medication with online coaching because it's not a medical program, but we can direct you to talk to your physician and to wean medications. And if you need us to help you wean medications, and you take a little vacation trip to Houston, their airline fly, you can find a hobby and come and see us once. And once you see us once, then we can put you in our digital health. And so then you have the remote clinical follow-up in addition to the online wellness. But the state of Texas require that we see you up front in person before we manage you, from out of state remotely.
And I have something to add to that, because that's a really important point, because you said that weaning the medicines is paramount in, this healing process, especially in a critically ill patient like this. Mm-hmm. And weaning medicines is not something that a lot of our colleagues is accustomed to doing in this type of setting, especially. And you see how much science and how much intricacy is involved in something like this. So, I mean, I think when to give Dr. Montgomery his due as far as knowing this information, there are not a whole lot of doctors that are going to do that. And I'm saying that because I've worked with people in my family who are older and on certain medications, and the doctors do not voluntarily wean. or even kind of recognize that things are getting better because they already have set in their mind that it's going to go this way, 1, 2, 3. It can't go in another direction. So that is something where, coming down here, which I know some of your patients do, is a realistic option. And then to have, you all on board.
Yeah, and that's an important thing. And I'll add, my colleague, Dr. Palmer, does work with patients too. So you have any pediatric patients that need help, you come down and seek her out as well. And because that would be really key. And she recently coached a patient whose baby was born with a congenital hole in the heart. And she coached the patient's mother, and they did a number of natural things. And the cardiologist prescribed them with diuretics, but the patient mother never took the diuretics. Now, she didn't tell her not to take the diuretics, but she followed her and coached along with the natural things. And the latest I heard is that the patient, the baby, is better without the diuretics and the holistic thing. You want to add to that, Dr. Palmer, in terms of the upgrade? Did I say enough or too much?
No, you said enough.
So I'm putting her on the spot, but that's okay. She likes to hide her secret, her magic, but she does a lot of magical things. There are a lot of things that we do here in the Houston area that's really powerful. And so again, hit the thumbs up button, share, like, subscribe. This is something that we want the world to know about. We have a small fledgling channel. We're doing some things to grow it. I'm getting some help, but you can help us grow it now by sharing this. So share this with 20. Each of you go on and share this with everybody watching, whether you're in the chat or not. Share this with at least 20 people that you know, maybe even 100 people if you can, and have them look at this video. Anything else, Dr. Palmer, before we sign out?
No, I mean, I think, it's good information, and it's time that people know that there are options, and we have to take some accountability and start now.
Yeah, and the answer to Regina Coleman's question, or somebody questioned, do we still have a 7-day program? We do have a 7-day program. Let's see, Ms. Brunson asked that. There are a lot of programs. You go online and send an email to our team, or call the office and ask about the 7-day program. And we have meal plans and the like if you're in the Houston area. If you're not in the Houston area, we do ship meal plans. And so there's a whole host of things. You can go on site and we can send an email, and we can give you a call as well.
And I do want to add one more thing. I think, it's good that we want to do these programs. But when I say we need to start now, I think we need to start changing our mind about detox, the word detox, and this needs to become a lifestyle. So we don't think about it as something that we just do for, 4 weeks or 7 weeks, and then we kind of go back. Yes, we do it for 7 weeks, and then we make changes after that 7 weeks until we do the next detox in the next, few months. We do another 7 weeks, and we make changes every time we do a detox, such that in 2 years or a year, or however fast you want to do it, now we've gotten to a point where we live in that space. Mm-hmm. I mean, we will always have to do some type of cleansing because of the environment that we live in. So, I mean, that's true, but we can now remove thinking about, did these potato chips is going to cause me high cholesterol? We can take that off the table. We got a whole lot of other things on the table to deal with.
No, that's exactly right. I think the mindset is really important. I think the long-term change is not a fad. You're exactly right. And we kind of come into it for 4 weeks and then trick you and say, oh, by the way, let's keep going. But no, I think getting your arm wrapped around a certain finite period of time is helpful, but you're exactly right. It's really a lifetime, especially if you have advanced diseases, and it really does work. It just takes the work to do it. And it's not as hard as you think. It's not nearly as hard as you think. I want to leave everybody with that comment. So anyway, all right, guys, thanks a bunch. It's been great, Dr. Palmer. I'm going to see you backstage. As usual, we had a good time tonight. I hope you got some good information. Again, hit the like button, thumbs up, thumbs up, thumbs up. Please give us the like button so this will trick the YouTube algorithm in sharing this with other people. Also, you go on and share it with other people as well, because I think this is good information for us all to have. I enjoyed this session with you this evening. I look forward to seeing you next week. And until then, keep it fresh, natural, and live.